You and with the President. Thank you so much, Mr. President, for sharing this moment with us. You know, one of my mentors here on the Hill has this saying that some senators come here to make a point and others come to make a difference. The first time Senator Sanders and I sat down together, he said, "Roger, do you want to make a difference?" We have worked so hard on this issue together, developing rapport, confidence in each other, in our staff. They've all done an incredible job as we try to get through this riddle of healthcare challenges across this great nation. I think as both of us travel back to our home states of Vermont and Kansas, what we found is not everybody has meaningful, affordable access to primary care. So we went out and tried to find the best actors. Where were the best outcomes? Who was making a dent? And I think we both discovered that our community health centers were doing a great job. They'd taken many pilot programs and they were improving them. I'm not sure what Senator Sanders would talk about some of his, but what I saw is this meeting patients where they are concept, integrating all the different elements of primary care. Not just your blood pressure, not just your AccuCheck, but also your mental health, dental needs as well, are just a few more things that we're seeing being integrated into the community health centers. Nutrition coaching, something that's seldom been done in clinics before. So I think we saw these community health centers as doing a great job, and we asked each other, how can we improve upon them? And Senator Sanders and I agreed on this lofty goal that we could get more Americans into these clinics, and that was a great solution for primary care. So for the past 3 months, we've had a very thoughtful approach to this problem. And even before then, our committee has had multiple hearings with different folks as they've tried to address the problem as well. And then we've had multiple Zooms and meetings with folks back home. How do we solve this primary care problem? And again, this mental health epidemic just slapping us in the face every time we go back. And certainly, I think most of our committee would agree that the community health centers are a great solution, but they need to be bolstered and need to continue that mission across this great nation. So I'm proud of the work that we've done on the community health centers in this legislation. Again, thoughtful legislation, and our goal is to make sure that it doesn't cost the American taxpayer any more. Again, the Senator Sanders and I have both said many times, this country is spending plenty of money on health care, but maybe we need to refocus a little bit more of it to primary care. So that's what we've done with this legislation, again, with a thoughtful approach. And our goal, again, is to make sure that it's all paid for and it doesn't cost the American taxpayer anymore. I think the other big issue that we found in common with folks back home is a nursing shortage and a primary care doctor shortage. If there's one thing that this bill would do, it would turn around the nursing crisis in a matter of just 3 years. My own wife is a community college graduate nurse. 90% of the nurses in our hospitals in Kansas, especially the rural hospitals, are 2-year community college graduates. So what we've done with this legislation is bolster more money for nursing programs. And the other program, like Senator Sanders said, the other challenge is colleges cannot afford the faculty, the nursing faculty. So we have some money to help bolster that program up as well. We have young men and women standing in line for incredible jobs in healthcare, but we don't have the faculty to bring them in. So we help with scholarships, we help with the faculty. That alone will change the dynamics across America if we have more nurses who are just the glue to this healthcare system. And then the next challenge that we attack here is just a shortage of primary care doctors in so many ways as well. So the legislation addresses that. It's great steps forward. I've been very proud, again, to work with Senator Sanders and his team, finding common ground, and I think we've made incredible strides. Senator Sanders and I have talked many times about our community health centers, and I might just ask him about the successes that you're seeing in your community health centers are, and what's your vision going forward that it looks like.
Well, thank you, Senator Marshall.
I'm from Vermont.
This is an issue I have worked on.
Senator Sanders and I have discussed this vision of what primary care looks like in the future, of making sure that we're meeting patients where they are. Some of our community health centers back home are bringing in food bank. They're bringing in WIC programs, social services, able to do basic mammography in those units as well. We lose track of the patients is when we got to have to say, look, come back in a month for your mammogram. Instead, it's such a great thing to say, let's get it done today. But one of the biggest underserved areas of medicine is dental. And I know this is one of Senator Sanders' visions specifically in this legislation, is to address the dental crisis. As an obstetrician myself, the only known cause of preterm labor is poor dental health, caries, cavities, whatever you want to call it. That's but one. There's lots of links to having cavities and poor gum health to having heart attacks as well. It's a way under-recognized challenge for primary care. I can't tell you how many times I've been called at 10 o'clock at night, 2 o'clock in the morning on a Saturday with one of my OB patients that's obviously very pregnant, but she has a cavity. Now it's turned into an abscess, and I can't get her into a dentist. And I'm calling all my buddies, and again, it's Saturday, it's 10 p.m., all my buddies, the dentists are gone. So Senator Sanders, maybe you would just share a little bit about your vision on dental and how this bill impacts that.
Senator Marshall, thank you very much.
From Vermont.
Discussion of what our vision is for these primary care community health centers. I think that we all realize we have an obesity epidemic in this country too, a type 2 diabetic epidemic in this country that we need to address on the front end. And I'm so happy to see some of my community health centers coming in. They're doing nutrition classes. They're doing cooking classes. I think so many folks of our current generation maybe learned how to do some cooking. The fast foods were a little bit too easy. So I think it's that out-of-the-box thinking, these different programs, and I would call it coaching. We need to be coaching folks up and teaching them, but also give them the opportunity. So whether we're on the Ag Committee and working on food programs, we're trying to bring all these pieces together in the program as well. And I know Senator Sanders is also certainly committed to helping us address. He's been a leader, in this issue of trying to take care of folks with diabetes as well.
Let me just say, Mr. President,
I might just close with a couple thoughts. Again, we came in with the lofty expectations that we could make a difference in primary care for people across the nation, and I think our bill accomplishes just that. And again, I can't thank the staff enough for their support through this. Senator Sanders and I spent most of the August recess, and our staff spent every moment of every hour of every day on this August recess working on this legislation. I think it's a good product. I think there's always opportunity for improvement, and we're welcome to those ideas. I appreciate the senator using traditional hide protections at the appropriate places, so we've maintained that, which is important to many folks, including to myself. So I think we've addressed primary care issues. I think that we have a plan to increase nursing workforce. Again, in 3 years' time, we can turn that problem around and long-term address some of the primary care issues, addressing dental as well. I think it's going to be a huge improvement. And at the end of the day, you cannot overestimate how much money this will save programs like Medicare and Medicaid and health insurance back home and help drive the cost of health care down for people. I'm glad to see us try to emphasize maybe some better ways to spend the American taxpayer monies. But most importantly to me, the physician is this is the right thing to do. This is absolutely the right thing to do. It's a chance to improve the health of Americans, and I'm just proud to stand here beside Senator Sanders and introduce this legislation. Thank you.